In 2012, Felipe was the first baby in Fiji to be immunized with the rotavirus and pneumococcal vaccines as part of a strategy to reduce child mortality. In schools across the country, young girls are being immunized against the human papillomavirus, which is a leading cause of cervical cancer. These vaccines, procured by the Ministry of Health after signing a cost-sharing agreement with the Fiji Health Sector Support Program, are part of the Ministry of Health's 2011 to 2015 strategic plan.
Since Felipe had that injection, till now I haven't been taken to the hospital for any sickness like diarrhea or pneumonia.
The impact of the pneumococcal and rotavirus vaccines in Felipe's life is a story that is being repeated across the country as the Ministry of Health strives to maintain an excellent 95% immunization rate.
Sustaining it is very important. Sustaining it and making sure that we've got that coverage rate up there right throughout, because with child health, these vaccines are very important because these are basically called vaccine preventable diseases, and children are vulnerable to that.
The Australian government is also assisting the ministry to set up a long-term study to measure the impact of the pneumococcal and rotavirus vaccines into the country. Teams are already in communities gathering sociological and medical data to establish a baseline for the study.
The ministry then should have information to say, okay, yes, this vaccine's of benefit to our people, and so there's an evidence then to show that if they're vaccinated, then there'll be less children going to hospital with pneumonia, less with diarrhea, less with meningitis, and we anticipate that we find that those benefits will also flow over into unvaccinated population because of the herd immunity effects by stopping the transmission.
We started off with FHSSP supporting 100% in the first year. And now we're at a point that next year in 2015 we'll have Ministry of Health covering up for 100% of the vaccine cover cost as well. It shows a pretty good partnership and exit strategies as well of programs where one starts it off, a donor partner like DFAT starts it off and it transits to Ministry of Health. And this was something that was supported by by the government.